Assalamu alaikum, brothers and sisters. My name is Omer Elhassan. I'm an NHS junior doctor working in this time of COVID in the NHS. So I've just been asked by Omer Media to perhaps just give a little reminder and a little bit of an update as to what's been going on recently. As you're all aware, we've had, unfortunately, the coronavirus that's been spreading through the population all around the world. It's gone from a local issue in China, in Wuhan, to what we call an epidemic, which is spread across the country of China, and then to a pandemic where it's spread across the world. And as we know, this virus has a balance between infectivity. So it's infective enough that it can spread between people, oftentimes without our awareness. And unfortunately, it also has a relatively high mortality rate, i.e. the percentage of people who get it, who sadly pass away, is higher than the average flu. That said, the mortality rate is perhaps not as high as some other plagues that we might have heard of, from the Spanish flu, or more recently things like Ebola. So alhamdulillah for that. So I just wanted to give a reminder, as we know, Boris Johnson has, and the government broadly, has recently been giving advice to people as to, how to self-isolate and what we should be doing in this time. Perhaps their message wasn't necessarily the clearest, but I think we should all be able to take the initiative and to assess our level of risk as individuals. Are you someone who's high risk, who has medical problems, especially lung problems, so things like asthma and COPD? And other diseases also make a difference, high blood pressure and diabetes. And we should all, inshallah, make our best effort to make an assessment of the risk to ourselves and to our families, and avoid mixing with other people as much as is possible. Work is obviously a difficult situation for a lot of people who can't work from home. For those people, it's even more critical that you assess the situation. How much is the risk of you going to work? Working alone is obviously less risk than if you're someone who works in a big office or where you might meet lots of people. That's the kind of thing we want to avoid, if at all possible. So as of yet, unfortunately, there's no really good treatments that we're aware of for the coronavirus. There are things being worked upon and studies being done, but so far we've not had anything conclusive. Inshallah, a vaccine will come out at some point within the next year and a half perhaps, that allows us to vaccinate people and to ensure that, or at least reduce the risk of people suffering from the virus. One kind of story I want to relate to you all, inshallah, is a story of Umar ibn al-Khattab, where he was approaching Syria, and as he was approaching Syria with his companions, someone related to him that there was a plague in Syria. So I don't know what the specific plague was, but I imagine it's something similar to an epidemic whereby lots of people in Syria were infected with a particular disease that was obviously a harm or a potential harm to people. And Umar, after consulting with those in his party from the Muhajirin, the Ansar, and others, had to make a decision as to whether to carry on into Syria and take the risk of being infected by this plague and potentially from it causing harm to himself and his party, or to stay away. And in the end, after discussion and with his companions, Umar decided that it would be better to return to where they came from. And one of the Sahaba with him, I think it was Abu Ubaidah, asked Umar, "Oh Umar, are you fleeing from the decree of Allah?" And Umar said, "We are fleeing from the decree of Allah to the decree of Allah." And that's a very beautiful point. All of us, our time is written for us. The amount of time that we have in this world, there's a hadith in Nawawi which says that before you are even born into this world, as Allah puts your ruh into your body, one of the things that is written for you, amongst other things, is the length of your life. So Allah knows, and He knew before you were born exactly how long you would live. And by Allah, however much we try to avoid whatever has been decreed for us will come to us, through whichever method it is. If we are to die tomorrow, then we will die tomorrow. And that's something that as Muslims, we believe in. We cannot escape the qadr of Allah. So one should not be afraid. Nothing will hit you except for what Allah decrees for you. And whatever Allah decrees for you, we believe, in a merciful, loving God. And inshallah, it is khair for us, whatever it is. That said, brothers and sisters, as Omer suggested in that story, we should avoid bringing harm to ourselves and to our communities if at all possible. And that's where the advice of staying at home comes in. Because at the end of the day, brothers and sisters, we need to understand that actually it's not just about us. We can be young, we can be fit, we can be healthy. Even then, we are perhaps at lower risk of coming to great harm from coronavirus, although it can still happen. We do see young people who suffer greatly and unfortunately have gone into ICUs and had various other difficulties like strokes come from it. But we also need to consider the risk to other people. There's a quote going around on social media, the message of which is, the virus doesn't move, we move it. And that's true. The virus moves through the human population. So if I had the virus couldn't get to other people unless I went to those people and I transferred it to them. So what we need to consider is actually the health of the whole country, of the whole population, our families and the wider, community, your local community and the wider community across the UK and across the world. So as much as is possible, we should be self-isolating. We should be avoiding going out into public unless it is necessary for various things, getting food and absolutely necessary your work, especially if you're a key worker, of course. Apart from that, we try and stay distant from other people. The people you live with, you have little choice, unfortunately. But we have the choice not to go outside for unnecessary reasons, to go to the park, to go for a walk. These things are things that we'd love to do and normally we would encourage. But in this time, in this day and age, perhaps it's something we should just hold back from. So inshallah, I'll just give a quick shout out to an organization called BIMA. It's the British Islamic Medical Association, which is an organization comprised of Muslim healthcare workers, from doctors to nurses to pharmacists, dentists. And you can go to their website. If you search British IMA on Google, you'll find their website, or go to www.britishima.co.uk. Inshallah, there's some more information there. And there's also plenty of information on the government websites. And bi'idhnillah, I make dua that Allah protects all of us. And with Eid coming up, this is a kind of further reminder, the masajid are closed. They're closed for a reason. And of course, this has not been taken lightly. My local masjid, who I'm very close to, it was a big discussion that we had amongst ourselves in the masjid, whether to do this or not. And it really pains us to do so. But, we made the decision that to close the masjid was better. And the more correct thing to do. So even for our Eid Salah, unfortunately, we'll still be closed. We'll still be under lockdown. There are various fiqh opinions on whether you can pray at home or not. I'll leave that for you guys to research. Ask a reliable local scholar. Pray that Allah alleviates this pain and suffering of this coronavirus, and also alleviates the pain and suffering of all of humanity around the world, especially those who are under oppression. And I bid you Assalamu alaikum, inshallah, and I hope to see you all well. Assalamu alaikum wa rahmatullahi ta'ala wa barakatuh.